Daisy, welcome to the Health Path podcast. It's really good to be able to connect with you.
Hi, Alex. Thank you so much for having me here today.
No, I think I've never covered this topic actually. Well, both with the Health Path podcast and with my previous one as well. So I think it's a really important topic, I think, to have on the podcast, and hopefully some of our audience are really going to benefit from today's conversation, which is really around Lyme disease. But before we dive into that topic, are you happy just to maybe introduce yourself a little bit and maybe start sharing with our listeners a little bit about your journey as well?
Yeah, sure. So I'm a nutritional therapist who specializes in autoimmune diseases and more complex illnesses such as mycotoxin illness and Lyme disease. I chose this area of work because of my own experience with autoimmunity and Lyme disease, and the link between the two, actually, which I've kind of described in my book. So all my clinical experience is based around my own personal experience with this very, very difficult to manage diseases that are autoimmunity and Lyme disease.
Brilliant. So do you want to share a little bit about sort of your own health journey, Daisy? Kind of what did that look like for you?
So basically, I retrained as a nutritionist because I was diagnosed with 3 autoimmune diseases in my mid-20s, and I took the conventional approach of immunosuppressants and steroids, and I was progressively getting worse. I was dealing with rheumatoid arthritis and 2 other autoimmune conditions, and that's when I discovered functional medicine, and within 5 years I got off all the 6 medications. And at that point, I decided to change my career and help people such as myself. So fast forward 5 years, I did a part-time master's degree whilst working full-time. I'm starting to now see clients with autoimmune diseases. My health is well. I don't even think about my autoimmune conditions. I'm feeling much better than I was feeling, 10 years ago. And then all of a sudden, my health starts deteriorating. I got a twitch in my finger in July 2019 that I didn't think much about. And within 3 months, that twitch was everywhere. I was having severe brain fog. I was having non-epileptic seizures. I was having strange burning sensations at the bottom of my feet. I saw half a dozen doctors here in the UK that didn't know what's going on. They tried to rule out things such as brain tumor, but they didn't have a clue what actually is happening with me. I had a number of tests on the NHS for Lyme disease, which I insisted on having, and they all came back negative. So I did suspect that despite the negative Lyme disease tests, I did have Lyme disease. So at the beginning of the coronavirus pandemic in March 2020, I cleared up my savings account, packed my bags, and I actually ended up in a hospital in Germany where they knew how to properly diagnose and treat Lyme disease, where I spent 2.5 weeks. So this is my health journey in a nutshell. It's overcoming autoimmunity to then be faced with this really, really difficult infectious disease that is Lyme disease, to ultimately through my own research make the connection between the 2, Lyme disease and autoimmunity.
And what led to kind of that quite strong suspicion that Lyme was an issue, even though the NHS tests were negative? Was there something that led you to have that kind of, I guess, confidence to go to Germany for sort of testing and treatment?
So I never had the rush. I never found a tick. But through my own research, being a nutritionist, we all understand about root causes. I was just trying to go back. What can cause such a multitude of symptoms, from extreme fatigue to non-epileptic seizures? And then I started reading about this bacteria that has the potential to cause that. So I either thought that I have another couple of autoimmune conditions that have started from nowhere because my previous autoimmunity was well managed, or it's Lyme disease. And I did have the strong suspicion, although at that point, I had one borderline test, I had a strong suspicion that it's Lyme disease. I did also have a consultation with a colleague that specialized in Lyme diseases, and he then kind of explained to me how Lyme disease is sometimes a clinical diagnosis. So I had that to back up my suspicion as well. It was a bit of a gamble, but I was getting nowhere in the UK. In fact, I was being told things like, it's all in your head, it's not possible to have that many symptoms, it's not possible to have that many symptoms that are related, it's not possible to have a negative test and yet have the disease. And in many ways, Lyme disease is an impossible diagnosis, and yet it is possible.
Yeah, and you mentioned that you didn't have things like the bullseye rash. So just to take a step back, do you want to, in case we've got listeners who are very new to this kind of topic concept, do you want to just very briefly kind of lay out sort of what Lyme disease is, what sort of the bacteria you mentioned, and from a, I guess, a basic traditional perspective, what might be some of the obvious signs, symptoms that would suggest this is an area that needs investigation?
Yeah, of course. So Lyme disease is a persistent bacterial infection that usually comes from ticks, although there is some suggestions, excuse me, that you can get the infections from mosquitoes and other insects. There is some research suggesting that it may be transmitted from mother to a child and even through sexual contact, but these are still big question marks. So at the acute stage, one of the symptoms could be a bullseye rash, but that only appears in 20% of the cases. In the UK, most doctors think that you, or they'll take some steps to offer you antibiotics or testing if you have that rash, but that's only 20% of people. Other acute infection symptoms could be just feeling a bit run down, neck pain, light sensitivity, a bit of migrating muscle joint pain. At chronic stage, and most of my clients get to chronic stage because it's so underdiagnosed in the UK, Lyme disease can have over 40 symptoms. So at that stage, Lyme disease is likely to have affected your nervous system, your sometimes cardiovascular system. There could be an autoimmune reaction to the cardiac muscle. So in some cases, you can get serious heart issues. So some of the symptoms at chronic stage are migrating joint and muscle pain, severe brain fog, buzzing sensations around your muscles. You can have gut issues. You can have something called Bell's palsy, where the side of your face freezes. You know, there are many symptoms at that stage. What further complicates it as well is that when you are bitten by something that carries Lyme disease, you very rarely just get Lyme disease. You get these other things called coinfections, so things like Bartonella and Babesia, which themselves are quite serious parasitic and infectious diseases. So, for example, with the Bartonella, you very often get the buzzing muscles, but you can also get the very typical burning sensations at the bottom of your feet. And this is another symptom that I had, that doctors sort of looked at me as if I was going crazy. I was getting these burning sensations in the middle of the winter. And because of the unreliable testing, the multitude of symptoms, excuse me, Lyme disease should be a clinical diagnosis, but the issue is that there aren't many clinicians out there, certainly not many doctors on the NHS that understand Lyme disease beyond take 2 weeks worth of doxycycline if you have the rash and off you go. Rarely helps with the Lyme disease infection. Another thing that I would like to stress is that Lyme disease, because of climate change, deforestation, is actually a lot more common in the UK than the suspected 3,000 cases a year. In the book, I actually cite a study where they explain that there are suspected 2.8 million people in the UK living with chronic Lyme disease, and as many as 128,000 infections every year. So I don't know, I do believe that the 3,000 cases are grossly underestimated. I don't know exactly whether it's quite 128,000 infections a year. Maybe the true number is somewhere in the middle. But I'd like to stress that, for example, the two most common cancers in the UK are breast cancer and lung cancer. In total, they affect about 100,000 people a year. So that's much less than people that are potentially dealing with Lyme disease. And that's why I'm really passionate about spreading awareness.
Brilliant. Yeah, and I think what you mentioned around, it's not as simple as a bacterial infection and antibiotics being needed to eradicate it. I think part of your journey and your research shows us that there are these complications ultimately that come with it, including autoimmune conditions. So treatment is a lot more complex. It requires a lot more consideration, I guess, ultimately, than just a simple eradication of an organism.
Absolutely. If you are dealing with Lyme disease, you have to deal with the 3 I's. So you have to deal with the infection itself, you have to deal with the inflammation it creates across multiple bodily systems, and you have to deal with the immune dysregulation, or the autoimmunity I focus on in the book. I do believe that people that have Lyme disease tend to over-focus on eradication of bacteria, which is not always possible, especially if you're at the chronic stage. It is possible, let me stress, to get well. It's not necessarily easy or quick fix. There isn't such a thing, but it's possible to get well. Not always possible to eradicate the bacteria, in my experience. But one of the game changers is actually trying to modulate the immune system to sort of tune down that autoimmunity that the Lyme disease bacteria might have triggered. What I'm very, very keen to stress is that Lyme disease bacteria, it's called Borrelia burgdorferi, has got the potential to trigger multiple types of autoimmunity. So we know in nutritional therapy and functional medicine, the bacteria like Prevotella, Klebsiella, Helicobacter pylori, they can all trigger things like autoimmune diseases, things like rheumatoid arthritis. Because the Lyme disease bacteria Borrelia is more like a virus than it is like bacteria. So we all know about the spike proteins on the coronavirus, and there's about 27 of them, I believe. The Lyme disease bacteria doesn't give off these toxins like other bacteria that are called LPS, or lipopolysaccharides. The Lyme disease bacteria has got these lipoproteins on the cell surface, so a bit like the COVID spikes. However, there are about 120 of them that we know of. These cross-react with multiple tissues in the body. So they can cross-react with tissues on your thyroid, they can cross-react with cardiac muscle, in which case sometimes there could be fatal outcomes. They can cross-react with parts of your nervous system. That's why I think it can trigger multiple types of autoimmunity, and in a way, it's one of the most dangerous bacteria when it comes to autoimmunity. Another factor which I focus on the book is specifically brain or neurological autoimmunity. So up until 20 years ago, we didn't know much about brain autoimmunity. We thought that the brain is an immune privileged site where autoimmune reactions could not happen. Now we know that this isn't true, and research is focusing on something called microglial activation. The microglia being the brain's autoimmune kind of protectors. They kind of help the neurons as well, which are a crucial part of the nervous system. The Borrelia Lyme disease bacteria has got the potential to actually cross the blood-brain barrier and trigger something called microglial activation and trigger brain autoimmunity, where, as a byproduct, there could be damage of the neurons, death of neurons, which we know that don't regenerate. And that in turn is linked to a serious neurodegenerative conditions such as multiple sclerosis, ALS, Parkinson's, Alzheimer's. And in fact, even researchers such as Del Bresden are talking about Lyme disease being one of the triggers of Alzheimer's. I'm not talking here about Lyme disease being the sole trigger of neurodegenerative conditions. I am talking about it being one of the many underestimated triggers of neurodegenerative autoimmunity.
And you've mentioned that there are co-infections that often sort of are involved within this. It's not just Borrelia, for example. Are there any other sort of Any other infections or toxins? I mean, I often hear that sort of things like parasites or molds can often be another kind of piece of this puzzle ultimately.
Absolutely. And in the book, I spend a chapter talking about related and complicated. Mold or mycotoxin illness is very often there. And there is research that actually suggests that most people with treatment-resistant Lyme disease have got genetic changes to their human leukocyte gene or HLA area, which then it's not only linked with autoimmunity, it's also linked with some detoxification issues as well, which means that people that are living with chronic Lyme disease or acute Lyme disease potentially are more susceptible to accumulating environmental toxins such as mold. I test all my clients for mold, all my Lyme disease clients for mold, and I'm yet to find one that hasn't got really, really high levels of mycotoxins. And in my view, as a practitioner, you have to clear up the mycotoxins first before you can start dealing with Lyme disease. And both mycotoxins and Lyme disease can trigger autoimmunity as well. But of course, usually there are parasites, there are things like heavy metal accumulation as well. It's very, very complex condition, but I think practitioners wanting to know more about Lyme disease should also really understand mycotoxin illness, because symptoms can overlap. For me, there is a priority of dealing with mycotoxins first, then with Lyme disease and modulating the immune system.
So to check I've understood that, we're saying that in Lyme disease, it's possible that there's kind of an epigenetic change related to immune function, basically. And then that makes us more susceptible to some of these other things going on, like a mycotoxin illness. So this is why we see so many of these conditions just co-inhabiting, so to speak. It's because there's just an increasing susceptibility to most things ultimately.
Absolutely. And I do find that sometimes you can have, you can be infected with Lyme disease and it's dormant for many, many years. And when you're exposed to another trigger, usually mycotoxin illness, that's when the Lyme disease starts flaring up, because mycotoxins have got much greater potential at suppressing the immune system than Lyme disease.
Okay.
In my view.
And that's, I guess, a really important point to make, which is, you know, Borrelia, and correct me if I'm wrong, Daisy, but I guess from what you've said there, it's a little bit like maybe the Epstein-Barr virus in the sense it can be dormant. You can be walking down the high street and have a potential positive test, but feel somewhat healthy. But another stressor, perturbation, environmental trigger will allow it to kind of come outside its box and become problematic.
Absolutely, I believe that. And, you know, many people do get really scared when they understand about Lyme disease, and they do focus too much on eradication of bacteria, which I said at chronic stage, I don't think it's always possible, but it's all about modulating the immune system, managing these other things that can be managed. And, you know, things like COVID as well can be one of the reactivators of dormant infections as well. We definitely see that in clinic as well, and sometimes these histamine reactions and post-COVID symptoms that people are experiencing can be linked back to some of these dormant infections.
Okay. So with all that in mind, I guess a question coming to mind for me, and therefore maybe some of our listeners, is sort of, what would a process look like? So you've talked about this sort of clinical diagnosis and some of the symptoms that we might associate with someone with Lyme disease. So are we saying that initially we're looking for maybe almost a cluster of symptoms that if someone has, we're increasing our suspicion that sort of Lyme is involved? Do you do any lab testing alongside that when you feel it's appropriate? And what would that sort of journey, I guess, look like?
So because of the coinfections and other factors, whether there is already some kind of autoimmune process in the body, I some Lyme disease clients can present with different symptoms, so it's really, really difficult to pinpoint. But some of the more general symptoms that are present with many clients are extreme fatigue, migrating muscle pain, and joint pain. So looking for clusters of symptoms that cannot be explained, even for functional medicine practitioners sometimes. So looking for these clusters of symptoms. Sometimes with coinfections such as Bartonella, you can get neuropsychiatric manifestations as well. So extreme changes in mood, anxiety attacks out of the blue as well. So there could be a neuropsychiatric presentation there as well to watch out for. So it's people have to be aware of that, and also doing different gut protocols, for example, when nothing seemed to be working, or doing a thorough autoimmune protocols and testing for other bacteria, but again, having no success could be a sort of red flags that perhaps there's something deeper there. The most reliable testing that I have found at the moment, and the one that I use in clinic, is actually microscopy based. It's a method called dark blood analysis, which doesn't rely on your immune response to the bacteria. And another issue with these tests are that they only look for one strain of the Borrelia, the Borrelia burgdorferi, which was the originally found bacteria, but there could be over 100 strains of them.
Wow.
So I use this dark blood microscopy based method. There is a lab in Hungary that we use that have been developing artificial intelligence to be able to spot a very typical spirochete shaped bacteria in the blood. And with active infection, you can have as many as 100,000 bacteria in 10 milliliters of blood. So that kind of prevents the potential false negatives, but I would say probably no testing is 100% reliable. And again, you have to have that clinical knowledge there to even suspect and then look for reliable testing. I would say to people out there that may think they have Lyme disease, but thinking about testing conventionally, do not give up, even if you may have a false negative test. Some people take years to even get to the point of where they get positive and reliable test, unfortunately.
Yeah, I think from the limited amount that I know from Lyme, and obviously having worked at the London Clinic of Nutrition, where the likes of yourself, with your experience and knowledge, see clients, it's definitely an area where you absolutely need someone who's in the trenches on a regular basis, supporting clients, and maybe even like yourself, Daisy, of having that personal experience. I think it makes such a difference to the sort of therapeutic relationship when the territory of such dark, gloomy waters, when there isn't sort of necessarily, it's not a straightforward process, as you say. There isn't sort of a guarantee that you're going to get a positive test result, and you very much need that clinical experience. So I don't think we can stress that enough within this sort of topic.
Absolutely. And I know that not many of our colleagues out there work with Lyme disease, but we potentially see more people that are infected with Lyme disease than anybody else, really. And having that knowledge and understanding is really, really important. I find clients relate to my personal experience, because when you're dealing with something like that, when you're being told, okay, you're fine if you don't have a brain tumor, but we don't quite know what's going on with you. So, some doctors end up saying it's all in your head. It's not possible to have all these symptoms at the same time and for them to be related. People don't feel quite as alone. And that's why it was really, really important for me in the first part of the book to share my personal experience, which turns out is very, very similar to the experience of many people that have dealt with Lyme disease.
Yeah, absolutely. I was speaking with a medical doctor the other day who has long COVID, and some of the experiences he had of speaking with his colleagues who essentially were saying it's all in your head, how, he should go and do some charity work or rent a dog. And it's pretty heartbreaking to hear these stories, and I imagine Lyme is full of them, unfortunately. So where else would you like to take this, Daisy? Are there any other kind of key areas of kind of Lyme that you think are important to share with our listeners?
I think, again, it's important to stress you have to be aware of, the multitude of symptoms. For any practitioners that are out there listening to this, if for any doctors listening to this, it's not all about the bullseye rash. It is a common infection in the UK. It's the fastest growing vector-borne infection in the UK. And I think predictions are that, rates may increase as well. Again, I would like to stress about the autoimmunity element of it, because again, from personal experience and clinical experience, autoimmune conditions, I don't believe, are very well managed. Although the research kind of looks at the multitude of triggers, the actual common management of autoimmune conditions on the NHS is just suppress and kill the immune system and hope for the best. I was one of those patients on chemotherapy drugs every week, was getting worse, and being told, that I'm going to get disabled within, 8 years. So if you suspect that what you have is mimicking something else, because I have had a few clients that they have been told they have atypical rheumatoid arthritis, where instead of the symmetrical pain developing in the small joints, they start having joint pain, like in the larger joints, like knee pain, and all of a sudden that knee pain's moving, it's, in the elbows, and they're still being told this is rheumatoid arthritis when it clearly isn't. Just investigate, and just don't agree. If you have to be an active participant in your health journey. That's the only way, unfortunately. If you suspect you may have something else, or you suspect that the management of that disease is not the right one, find the right doctor, find the right practitioner. Look for the autoimmunity element. I don't believe that our immune systems can just start attacking self-tissue. I think it's a preservation mechanism. I think very often they can get confused. And in the book, I explain about this mechanism of molecular mimicry. Very often it's the case of mistaken identity, where, the structure of bacteria, such as Lyme disease bacteria and viruses and some toxins, cross-react with tissues in the body. So I don't believe that. I know it sounds a bit out there that autoimmunity exists. It's a case of mistaken identity. By finding that trigger there, and sometimes may not be possible, there could be multiple triggers, I get that, but find that trigger. That's the key to managing any autoimmunity, whether it's Hashimoto's or rheumatoid arthritis, or chronic Lyme disease.
Yeah, and I was going to get you just to kind of expand on something which you actually now have done, which is, you mentioned earlier the concept of migratory symptoms. And what you mean by that is, as you say, sort of 1 month it's pain in the knee, and then suddenly it's pain in the shoulder, and it's kind of moving around the body on a regular basis. Is that what you're referring to, this kind of migratory?
Yeah, another typical thing about Lyme disease, that symptoms can wax and wane. On one day, you can have symptoms that would resemble rheumatoid arthritis, and next day it will be all the muscle weakness, things that resemble things like multiple sclerosis, or you feel that all of a sudden your memory has got really, really bad, and you're thinking, am I getting Alzheimer's at 25 or something like that? And these symptoms can come and go. Sometimes you get things like antibiotics for unrelated condition, and you start feeling a bit better. And you think, okay, I wonder whether there is a connection there. So that's another typical thing. Symptoms can come and go. Infections can lay dormant for a long time and then be triggered by something unrelated.
And before we move into, I guess, a question I have around, for want of a better word, sort of treatment or interventions, things to consider from that perspective. Is there anything else that you just want to sort of expand on around, I guess, symptoms, testing, the challenges with diagnosis? Do we feel we've covered that part?
For me, it was really important to stress about the autoimmunity. It's really important to stress that if you don't feel you're getting the answers that you need to, you just need to try and find a practitioner out there that understands the complexity of the condition, and to not give up. I think when you're being told that you probably have mental health issues because of these symptoms, when you're being told that you're having potentially an impossible illness that can take its toll on mental health, try and find, support networks around you that can help you on that very, very difficult journey as well. That's really, really important. And clinically, I see clients that have really strong support networks around them do better.
Okay. Okay, so I guess we've covered, Daisy, sort of signs and symptoms. We've covered sort of the challenges in diagnosing Lyme disease. We've discussed co-infections and sort of comorbidities with things like mycotoxin illness being very common in people with Lyme disease. So it seems natural to move the conversation maybe into sort of treatment and therapeutic interventions and what we might want to consider if we are now at that point in our journey, I guess. So what have you found, I guess, either in the research or just sort of clinically, that we might want to be considering with some of the things that you've touched on so far today?
Okay, so first of all, I just want to briefly cover the treatment that's available on the NHS if you are found to have it on the NHS through some of the tests, and why I don't think that's always successful. So currently on the NHS, the guidance is that if you have a successful test and the bullseye rash, which again only appears in 20% of cases, you'd be given 2 to 4 weeks of antibiotics such as doxycycline. Antibiotics usually work on quickly dividing bacteria. Most bacteria would divide twice a day. The Lyme disease bacteria is very, very slow dividing. It divides once every 16 days, I believe. So most antibiotics that are done have to be really, really long courses. Sometimes people have been on antibiotics for years. Another issue why I don't think all antibiotics work is the Lyme disease bacteria ultimately aims for the brain. It crosses that blood-brain barrier. It causes that havoc, sometimes neurological autoimmunity, which I covered, and not all antibiotics cross the blood-brain barrier. That's another issue. I don't believe doxycycline does. So very rarely I find that doxycycline for acute infection, if you've just been bitten, you caught it early, you took the course, you may be fine, but I don't believe such a short course of this type of antibiotic would work for neurological Lyme disease or chronic Lyme disease. So other treatments that I apply in clinic, let me split them. So, I mentioned the 3 I's: infection, inflammation, and immune dysregulation. So for the infection side of things, many practitioners and myself that work with Lyme disease, we use herbal protocols such as the Buna protocol. It's a combination of herbs that help eradicate the bacteria. It's very, very important whenever these protocols are applied to actually use something called biofilm disruptors. So first of all, the Borrelia, it's not only really, really hard to kill, it can drill itself into tissue, including the brain. It kind of hides into scar tissues and things like that to escape things like antibiotics, but it can change its shape and it can form these biofilm colonies, a bit like igloos, of bacteria stuck together to protect itself from the immune system, and the Borrelia is very, very good at doing that. So alongside the herbs to actually kill off the bacteria, it's really, really important to use biofilm disruptors, things like serrapeptase and nattokinase, enzymes that are very widely used for other things as well in functional medicine. Sometimes these courses of antibiotics have to be, herbal protocols have to be quite long, and the protocols have to be tweaked slightly. Some people can experience things like Herxheimer reactions or Herx reactions, where your body kind of reacts negatively. Your symptoms can essentially get worse when you're killing off too much bacteria and your detoxification pathways, such as the liver detox, is not working properly. So you have to manage these as well. So that in itself, just the eradication of bacteria, is quite a complex thing to do. And then you deal with the whole inflammation sides. So bacterial infections such as the Borrelia, they produce a lot of cytokines, make your body produce a lot of cytokines, which are inflammatory messengers, cytokines such as IL-6. And, you know, there could be a bit of a cytokine storm happening at the same time. We all know about cytokine storms in COVID. So you have to deal with that with, you know, anti-inflammatory supplements and nutrients such as curcumin. So that's another element to it. And then there's the immune dysregulation and autoimmunity element that are covered in detail in the book. So this is things like actually applying autoimmune paleo style diet, applying different herbs for the modulation and vitamins for the modulation of the immune system, vitamins such as D and A, you know, trying to consider things like adrenals and thyroid at the same time. I spent quite a bit of time in the book talking about what is there in terms of research about specifically the neurological autoimmunity and that microglial activation, because I find maybe 99% of people with chronic Lyme disease, their nervous system is severely affected. You know, from symptoms like brain fog and severe cognitive decline to loss of balance. You know, your peripheral nervous system can be affected too, with twitching muscles and pain across muscles in the body. So more specifically for that neurological autoimmunity, I talk about nutrients such as glutathione, high doses, resveratrol, liposomal resveratrol, mixed tocopherols, and other things that can help that specifically neurological side of things. And all these nutrients can cross the blood-brain barrier. They can calm that microglial activation that's driving these symptoms. So when you think about Lyme disease, think about these three elements to it. People tend to just focus on killing off the bacteria. Killing off the bacteria is not going to get you well. If you have had it for years, if it's damaged multiple parts of your system, if it's triggered autoimmunity, killing off the bacteria, A, it's not always possible, and B, it's not just, you're not going to regain function in some of these organs. Lyme disease is also a really, really dangerous disease because it's been known to kill the two post-mitotic cells in the body, so cells that do not divide. So once these are affected, there could be serious organ damage. So one of them are the cardiac cells or the heart cells, which I already mentioned that in some cases you can get Lyme carditis, which can be fatal. So it can kill off the cardiac cells, which do not regenerate, and it can kill off neurons, you know, the cells in the brain, which again, we know that they do not regenerate. So therefore is the link with these serious neurodegenerative conditions. So don't just focus on killing off the bacteria, focus on the two other eyes.
Yeah, I think that sort of breakdown of the three eyes is so helpful. And I think it's always nice to have some form of structure, even though it's going to be highly personalized and there's a lot to consider. It still gives us a really good sense of the things that we do need to consider. And this idea of not just eradicating, killing off the bacteria really resonates, because, you know, it's true even from something slightly more simple in some ways when we think about the gut microbiome. You know, it's not just about killing off a potentially pathogenic organism. It is the relationship, as you've been saying, that the immune system has with the organism that has such a big deciding factor on whether the organism is going to be creating dysregulation, for want of a better word, or not. And I've definitely seen clients where they have something like ankylosing spondylitis, where we know that Klebsiella pneumoniae, there's research of it being sort of this environmental trigger, but seeing people significantly improve their health, sometimes coming off medications, but still seeing Klebsiella pneumoniae in a retest in a gut test was kind of a really big lesson for me, that it is very much about the relationship sometimes and not just about the organism per se. I think that's such an important message to get across.
Absolutely. And don't just over focus on killing off the bacteria. Is it still there or not? Because some people may feel disempowered. Some people may feel, oh, I still got it. It's just focus on improving symptoms. Sometimes it could be marginal improvement. Just try and focus on that. Try and stay positive. For me, the attitude that you approach some treatments with and protocols with is almost as important as the protocols themselves. You know, your attitude, your belief system, I believe, have a really, really strong effect on your immune system function, which ultimately needs to be adequate to manage something like Lyme disease. Another point that I'd like to make is that with complex Lyme disease, like with many other complex conditions, often if there is any underlying trauma, that can resurface and kind of compound other issues that you're dealing with, such as, you know, denial from the medical profession or difficulty. There's often lots of relationships and jobs and things like that. But very often I see that with clients, there's trauma that resurfaces, and the better you get at trying to deal with that trauma and managing it, that kind of can also affect your immune system. So it's really, really also important to approach this quite holistically.
When you say trauma resurfacing, what do you mean by that? Do you mean things when you mentioned obviously denial from the medical system, for example? So are you saying that the experience of having chronic complex Lyme is essentially triggering historical experiences and trauma that then is essentially, I guess, is dysregulating the autonomic nervous system and doing all sorts of other things that then, as you say, compound the situation?
Yes, yeah, it could be that, or it could be more serious things like childhood trauma, which we know are also linked to immune dysregulation. And it's not the easiest thing to deal with, and I'm not a specialist in that area, but I do recognize it sometimes in clients, and I ask them to contact professionals and deal with that. So I think that further can compound Lyme disease and the immune dysregulation element of it.
Yeah, absolutely. Okay, fascinating. Daisy, is there anything that you would like to finish with? Anything that we haven't touched on yet that you would like to, or anything that you want to sort of reaffirm?
It's, again, maybe keeping to that structure that you said. It's good to have that structure. If you if you know you're dealing with Lyme disease, keep to that structure, understand the difference between the 3 I's, the infection, the inflammation, and the immune dysregulation. All of them have to be dealt with. Unfortunately, because of the stigma around Lyme disease, the lack of research, the underappreciation in the current medical system, a lot of Lyme disease clients tend to go on these forums and they look for a silver bullet that's gonna cure it all. There isn't such a thing. For me, you have to stick to the 3 I's. You have to build like a little pyramid of different things that you do, including dietary changes, herbs to eradicate the bacteria, things to modulate the immune system, things like DNRS or dynamic neuronal retraining programs, such as the ANIHOP program, can really, really help with the nervous system dysregulation element as well. So it's a very complex condition. There isn't one silver bullet for it. Stick to the 3 I's and do things that relate to all of them at the same time and for long enough. And I just want to, I've got the campaigner in me, having gone through that, and just I'd like to use the opportunity to stress that Lyme disease is a lot more common than we think in the UK and in Europe. You can get Lyme disease whilst traveling on holiday. In fact, I do think I got mine when I was traveling in South America through a mosquito bite. But I'll never know. So it's a lot more common. It's really difficult to diagnose. And finally, I'd like to say, try and be positive. Try and be your own best health detective. do not take, you don't have this, or it's all in your head for answers. And you need an attitude that matches this really complex disease that can trigger autoimmunity. You need belief and perseverance and being resilient to actually deal with it. Those qualities are really, really important.
Brilliant. Daisy, thank you so much for coming on the show. It's been great to hear someone with, your experience and knowledge share and discuss such a complex topic ultimately. So thank you.
Thank you so much for having me. It's been such a pleasure.
Where can people find out more about you? Where is your book available? Do you want to just share those sorts of contact details?
So people can find out a bit more about me on my website, optimalhealthnutrition.co.uk. I also have social media channels at Optimal Health Nutrition, and one more specific about Lyme disease called at the Lyme Nutritionist. So I see clients online in my own clinic. I also work for the London Clinic of Nutrition, which is one of the most established and well-known functional medicine clinics in Europe, really. So do check me out on social media and my website. The book is available on Amazon. It is available in the hard copy and Kindle format. 10% of all proceeds also go to a wonderful charity called Lyme Disease UK, who do great work to try and spread awareness of this illness.
Amazing. Thank you, Daisy. It's been a real pleasure.
You're very welcome. Thank you so much.